Good morning and welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, March the 17th. We are joined today by our CEO, Nicole Dupuis, our acting MOH, Dr. Shankar Nasathuri, as well as our manager of our epidemiology department, Ramsey D'Souza. We will start with our epidemiology summary report from Ramsey.
Good morning, everyone. Thank you for joining us for this week. I'll quickly go through the episummary, highlighting some key points that have come up for this past week's report. So let's start off with our case rates. So since our testing change towards the end of December, this past week was the first week that our high-risk case rates have dipped below 100 cases per 100,000. We're currently sitting at 99.7 cases per 100,000. This is about a 24%, 25% decrease from where we were last week. When we look at how we compare to the rest of the province, in general, case rates have been declining. There have been some health units where we've seen an increase. Windsor-Essex, though, continues to have a lower case rate compared to some of the higher ones across the province, such as in Northwestern, Thunder Bay, and some increases locally in the region, at least in Grey Bruce and in Middlesex, London. Our percent positivity, though, has remained high relatively in the past couple of weeks. We have seen an upward trend there. It's currently sitting at just over 14%. For a full completed week. And this is once again increased from where we were last week as well, for the previous week, sorry. When we look at our hospitalizations, we have seen some fluctuations in the past couple of days. However, they remain on par in terms of trends and from where the overall province is. It has been generally decreasing with some minor increases here and there on any given day. And this includes both for hospitalizations in general for COVID-19 and for ICU admissions as well. When we look at our wastewater surveillance, we have seen recently an increase in signal intensity when it comes to wastewater surveillance, and that same type of trend we've seen in the previous weeks as well, where typically what has happened is we've seen an initial increase followed by a decrease. However, for this past week, we have seen a general increase. So just in terms of what we're seeing here, typically wastewater surveillance, it's an early predictor of what could happen. However, we'll continue to monitor to see if that trend continues to increase or if it's just a temporary increase that we observe. When we look at our deaths in the past 3 weeks, actually, we've seen 3 cases reported 2 weeks ago, 5 deaths reported the week prior, and 4 deaths in this past week. So we continue to see deaths related to COVID-19 in our region. Though in the past few weeks, it has remained fairly stable in terms of the number of deaths that we're seeing. With regards to the outbreaks, last week was one of few weeks where we did not declare any outbreaks, compared to 2 weeks ago where we had a couple of outbreaks that we had declared. But once the important caveat is we are only looking at outbreaks in high-risk settings, whereas previously for the majority of the pandemic we were also looking at outbreaks in other settings as well. When it comes to our vaccination efforts, for those that are fully vaccinated, we continue to see incremental increases. We're currently at 83% when it comes to those individuals 5+ that have received, that are fully vaccinated with the primary series with 2 doses. Whereas with third doses, there is still room for improvement across the board. Though we do have good coverage rates in our older population, but in our younger population, there is still some room for improvement in terms of getting those numbers higher. And for this week, that's all that we have. Thank you so much.
Ramsey, if I could just ask you to comment and be sure that I'm understanding this right. When we look at the number of cases, it would appear that there's a large group of cases in Northern Ontario, and then the health districts that are adjacent to us followed at a higher rate as well. Is that right? When we go back to that table.
That's right. So the Northern Health Units have been experiencing an increase in the last couple of weeks, whereas some of our local regional health units, I'd say, in terms of our in the Southwest, have also seen increases as well, though it's not as prominent as what's being experienced in the Northwest province.
Right. So I think my point would be, and if it's a correct one, is that Southwestern Ontario seems to still continue to have a disproportionate burden of disease when we look at our health district and the two adjacent health districts.
That's right.
Okay.
Okay, thank you. We can move into our first round of media questions, starting with CBC.
Hello, good morning again. Fourth doses of a vaccine have started, I believe, at the beginning of the year for those who are very high risk and immunocompromised. With masking restrictions being lifted, is there any thought going into or any discussions about opening up the eligibility for fourth doses?
Well, I think in general, we follow the provincial and federal guidance related to vaccine policy and vaccine distribution. I think in general, as we move more forward to a new level of normal, we'll have to plan for regular booster vaccinations of the population, of the community. And so I would anticipate as we move forward, there will be expansion of additional booster vaccines. However, I think the specific guidance we have to defer to the federal and provincial authorities on the schedule for that.
Thank you. Looking at Transit Windsor now, the Transit Windsor says that they're operating buses with a limit of 40 people because of WeChew guidance. I'm wondering, when was that guidance brought in, and has that capacity limit on those buses been lifted?
So WeChew does not have any specific guidance for transit. We did in the past, maybe it was in the summer before, but at least since then, we have continued to provide Transit Windsor to follow the provincial recommendations. Now the provincial guidance, I'm not as up on what changes are coming March 21st that are relative to transit. I know they will still require masking, but the previous provincial guidance did require considerations for spacing, which could be, why their number is what their number is, but that would be an answer, a question best asked to Transit Windsor, but we don't have a specific order or rule or Windsor specific guidance that applies to transit services here.
I could just follow up. If I could just follow up on that too, and I think Nicole makes some very important points. In the first instance, as we move to this new level of normal, organizations and institutions will have to make policies related to their businesses and enterprises based on an assessment of a risk. It's clear that in moving forward, that the pandemic is not over. We had 4 deaths last week, or this past week, 5 deaths the week before. I believe we had 5 deaths, and Ramsey can correct me, the week before that. And we've had approximately 600 people die of COVID up to this point in the pandemic. So the pandemic is not over. And all of us and every person in the community has to make some decisions about what level of risk they're willing to accept and what actions they're willing to do to try to modulate that risk, not only for themselves, but for others. And I think there's still a role for physical distancing, wearing a mask when you can't remain consistently 2 meters away from another person. Stay home if you're sick, get vaccinated, practice good hand hygiene. I still think there's a role for that, and that includes being on the bus and in other environments.
Thank you very much. Do we have any questions from Blackburn?
I'm joining pretty late at this point, so I really don't have any questions for you.
Okay, we'll catch you on the next round, Adele. Any questions from the Windsor Star?
Yes, good morning. The World Health Organization recently noted a global rise in COVID and has warned that there's more of that to come. Hong Kong has currently got the most severe and deadly outbreak in the world right now, and worse than at any time previous in the pandemic. Is this something that WICHU is monitoring, and what's the possibility of it impacting our region?
Well, we always monitor the burden of disease. Since the beginning of the pandemic, Ramsey and the team that he leads have been looking at the indicators to know what the burden of disease is. The Public Health Service in Windsor-Essex is very concerned, and we do stay informed about the worldwide burden of disease, including what's going on overseas right now, as well as what's going on in the United States. The current metrics that we have to monitor disease are primarily lagging indicators, which is death and hospitalization and ICU admission. I think the one thing we have to be concerned about is that we don't have as robust testing data as we did at different times in the pandemic, which makes making assessments and predictions just a little bit more challenging, or substantively more challenging. I think that decision makers and public health policymakers will have to look at the indicators, and based on the indicators, make recommendations regarding public health measures. I think as we move to this new level of normal, we have to understand that the pandemic is not over. There is going to be a varying burden of disease, and COVID-19 are not likely to be eradicated completely in the near future. So given that, based on the burden of disease, that we'll have to modulate public health measures and adjust them as we have different levels of disease. We'll also have to assign more resources at the hospital and in other healthcare organizations to provide for treatment for people with COVID. We'll have to spend the money as a community and society for the medications that might work to mitigate illness and disease. And this is also one thing to think about. The disproportionate burden of disease is borne by unvaccinated people. And if you're not vaccinated, I would ask that you get vaccinated, get your primary series, because that's one thing that everyone in the community can do to help themselves and to help other people. Not to be long-winded on this, but the one other thing to think about is, as you have more disease burden and you have more people hospitalized and sick, that means that the hospital cannot care for patients who have other diseases and other medical conditions which are important. I think in Windsor-Essex, the number today is there are about 4,000 people waiting for surgical procedures and other procedural treatment. And I would guess, and I would not more than guess, I would surmise that people's during the pandemic, the routine medical care of many patients has been disrupted. So I think we still have a challenge moving forward, and we should be informed by the experiences of other countries because, as we formulate our own policies here in Windsor-Essex. I'm sorry for that long-winded response.
Okay, thank you.
Any questions from AM 800?
Doctor, I know we've asked you this before in regards to different events and holidays, but today being St. Patrick's Day, the first basically get together, the new norm with most restrictions lifted. I just want to get your message, obviously, to the community, but also to business owners as well.
Well, St. Patrick's Day is an important day for people. It's a day to interact with our colleagues, interact with our friends. So I think it's happy St. Patrick's Day to everyone who recognizes it as a holiday or recognizes it as an event. I think like every holiday, we just have to be used in the context of the pandemic. Use good judgment, and that includes social distancing, wearing a mask when you can't stay 2 meters away from somebody, obviously the Public Health Service has always endorsed the low drinking guidelines, which I think for having a few drinks today is one. Having a few drinks on a particular day is fine, but just acknowledge there's also the low drinking guidelines that one can follow. But overall, our message is that people should enjoy St. Patrick's Day, but do it in a way that's responsible and is consistent with good public health guidance.
I guess, Nicole, for business owners, I'm not sure, will the team be out there enforcing the current restrictions that are still in place? And I guess your message to the business owners, I know it's been obviously hard for them the past couple of years, and this is a big day for them, but you still want the business owners, obviously, to follow those the restrictions that are still in place?
Yeah, our team is always out there, not just our team, but obviously, again, I know I sound a bit like a broken record, but we work closely with police by law, and we have other regulations that we enforce that are beyond the Reopening Ontario Act as well. So our team will always be out there. We'll always, again, our focus is always education and support, and certainly we want this to be a safe day and one that happy and full of enjoyment, and so that will be their focus. Is our team that's out there is providing support and guidance for businesses to ensure that fun can continue in a safe way.
Thank you.
Any questions from CTV?
Yes, good morning. Are you considering imposing independent mask mandates in schools? Has there been any conversations with the boards around that option?
Well, we have regular dialogue with school board officials. At this point, the Public Health Service is not considering any mandates to schools related to wearing masks. Obviously, it's something that we'll continue to monitor and have continuing dialogue with with our school board colleagues. The schools are governed by the school board and the Ministry of Education, and they have the substantive responsibilities for the operational aspects of the schools, but we'll continue to have dialogue with them. Go ahead, Nicole.
Thank you.
Sorry.
Maybe I would just add, not specific to schools, but just while we are speaking with all of you, and something that we will be putting out or communicating over the weekend, just knowing the number of people who will have traveled over the March break holiday, in particular, certainly families with children. Just a reminder to, again, check the guidelines for travelers when they enter into Canada from outside of Canada travel. And so even for those who are exempt, there are still requirements for mask wearing, up to 14 days, and when you're in public spaces. So that knowing that some restrictions are being lifted here on the 21st, but for those who have traveled, masks will still be something that they need to prepare for the next 2 weeks. So we'll be putting out some messaging, just deferring to obviously those federal requirements.
Yeah, if I could just supplement that, it is true that many of the directives or the mandates related to masking have been withdrawn. However, just because something is not mandated doesn't mean one should not do it or could not do it. In this particular instance, at this stage in the pandemic, I think wearing a mask indoors, especially when you cannot remain consistently 2 meters away from somebody else, is a good thing to do. It would help. It helps the person wearing the mask, and it also helps other people. And so the change in direction does not mean that individuals cannot still participate in improving the health of the community by wearing a mask when it's appropriate.
Thank you. Any concerns over the BA2 stealth Omicron variant and maybe chances of going backwards?
I think the Public Health Service overall remains concerned about the burden of disease. and that includes new variants such as this one and others. I think the rational approach is to understand that there are going to be other variants as we move forward. And as we had highlighted, there were 4 deaths last week, 5 deaths the week before, and I believe 5 deaths the week before that. So I think that the pandemic is not over. We have to monitor. We have to be concerned about additional burden of disease moving forward. And if there is additional burden of disease, we'll have to modulate our public health measures based on that, on additional cases presenting within the health system. The other issue is, and this is worth considering, is there are at least 2 items to consider when there's a new variant. What is the effect on the individual infected? And then what is the effect on the population? Meaning this, that some variants could cause a smaller number of people to get sick, but those people can get really sick. Other variants can infect many more people, but on an individual level, not make them sick. But because there are more people affected, that would lead to an additional burden of very sick people. So it's a little complicated when we have variants to make an assessment on what the effect would be on a population health level. But we are definitely concerned about the new variants presenting.
Thank you.
We have time to do one follow-up question per media outlet. We will start with CBC.
I'm all good, thank you.
Thank you. Anybody from Blackburn?
Yes, earlier this week, Christine Elliott said that the new variant, the BA2 stealth Omicron, would likely become the dominant strain by mid-month, but it wasn't causing an increase in hospitalizations. But then we see what's going on around the world, and Hong Kong in particular. What can you tell us about this variant? Is it more transmissible? Is it more dangerous? Right now, we really don't have a lot of information about what to expect from this particular variant. What is the research saying so far?
Ramsey, do you want to comment, and then I can supplement that?
So BA2 is a subvariant of Omicron. It is slightly more transmissible, but in terms of the severity, it's consistent to what we're seeing with the original Omicron variant. However, there's still more to know. The virus does mutate alongside this variant, so there's more research going on with the variant itself, and as time goes on, we will learn more and more.
With it being more transmissible, and you mentioned Dr. Shanker about Dr. Necessary about the numbers. You know, when you have more people sick, you have the increase to the hospital, even though overall it's not as bad. Are we ready for this? Are we ready for another wave in Windsor-Essex in terms of our hospitals?
Well, I know that the hospital leadership and executives are doing everything that they can to be prepared. Overall, I am very concerned about the burden to the healthcare system. Before the pandemic, hospitals, first I'd preface to say health is more than just hospitals, but the very sickest patients, the people who need the most intense services typically go to the hospital. Before the pandemic, hospitals were running at near full capacity or over capacity on a regular basis. That was before the pandemic. People were waiting for treatment for other conditions before the pandemic. People would wait months for a total joint replacement or for a cataract surgery. Sometimes people would wait months upon months for to see a specialist. Now we have the pandemic, and the pandemic has consumed COVID-19 related burden of disease has consumed a lot of hospital and other healthcare resources, and it's also affected hospital staff at different times. And I think many healthcare workers are also experiencing, for lack of a better term, burnout. For 2 years, many of them, 2 years of clinical demands. So as we move forward to some new level of normal, we have to assign the right resources so that we can manage COVID at a baseline level, manage COVID during its peaks, and also manage all the other things that are important in health beyond COVID. And that's going to require, in part, additional assignment of resources and bringing on perhaps additional staff and making priorities for health. As a doctor, I could tell you, just in my own experience, we have not invested in infrastructure in hospitals, and we need to spend more money if we're going to get through this pandemic and try to return to a more normalized healthcare system. So I do believe in the short term that hospital managers, hospital executives, hospital staff, nurses, doctors, therapists will all do their very best to help manage the pandemic and manage the caseload. But as a community, we have to make some tough decisions about investing resources so that we can have a sustainable healthcare system moving forward.
Thank you very much, and thank you for letting me sneak that second question in.
Thank you, everybody.
You're welcome.
Any follow-up questions from the Windsor Star?
Nothing further, thank you.
Any follow-up questions from AM 800?
Just one, sorry, going back to Melanie's question in regards to masking for schools. Doctor, I know you said basically no order, no mandate. Correct me if I'm wrong, that's the way I took it, that the health unit will be implementing. But you did talk about if you can't maintain distancing to wear a mask. So are you, and I know we all know youngsters, it's hard for them to maintain that distance. So are you encouraging parents to make sure their youngster, any age, I guess, child in school continues to wear a mask while they're in school?
So the policy as it relates to schools is governed by the school board and by school officials. From my perspective, parents can guide their children based on what they believe is best for their children. If parents choose to direct their children to wear a mask at school, I think that will help the child to the extent, and it'll help the other children in the class and the community overall. So despite the fact that there's no mandate or direction, I think that parents can make that decision based on the facts and circumstances and their assessment and comfort with risk. And it would be an entirely appropriate and reasonable thing for parents to do. There might be a higher risk of transmission or exposure. The second point is, at this point, the Public Health Service in Windsor-Essex is not contemplating any specific direction. I do think that we monitor the situation and we can formulate public health policy and guidance and direction based on the facts and circumstances at that time. The Health Protection and Promotion Act requires us to do that, and we'll continue to follow the framework of the statute.
Thank you.
And a follow-up question from CTV.
Yes. Do you have any updates on the vaccination status of the most recent deaths? I know sometimes you release the numbers in groups. Just wondering when we might see that information again.
Ramsey, do you have any comment on that?
Not at the moment, but we could look to do it for next week.
You know,
Okay,
on a population health level, the people who are dying of COVID are, as a general construct, two groups. One are people that are unvaccinated, despite the unvaccinated people constitute a smaller proportion, but a disproportionate number of the deaths. And the other are people that have concurrent or severe medical conditions, and many of those people with severe medical conditions are vaccinated. But perhaps Ramsey can shed some additional information on that as he gathers more data.
Okay, thank you very much, everybody. That concludes our briefing for today. Our next session will take place on Thursday, March the 24th. Have a wonderful Thursday.
All the best. All the best.